much.
Thanks.
Welcome.
Thanks, Jason. Thanks for having me. I am excited to give this talk as someone who commonly has to give people feedback, and also as a program director who gets fatigued reading over and over from residents how not quality of feedback, I didn't get feedback. So my plea to you is give feedback, give it freely, give it often, but we'll talk a little bit about an approach that'll be more helpful to you. So things that I'm going to try to accomplish today, we're going to talk a little bit about what the components of effective feedback are, spend a little time talking about our barriers to giving and perhaps receiving feedback, and then we'll spend some time working together evaluating effectiveness of some feedback sessions. Which sounds like role play, doesn't it? Stay tuned. Okay, so let's talk a little bit about components of effective feedback. Well, there's a paper that I would refer you to in the Academic Medicine Journal that talks about giving feedback. This is effectively is one of the defining characteristics of master teachers. This was actually done on inpatient medical student rotation, about 170 medical students, and there was a gentleman actually in the room whose name is on this, Dr. Elnicki, was also involved in this paper talking about effective feedback on bedside presentations, H&Ps, most appreciated by medical students. Probably a less well-known gentleman, Grant Wiggins, I just found out about this guy. Learners need endless feedback more than they need endless teaching, right? We actually we flip that. We give endless teaching and infrequent feedback. It's probably more helpful to give the feedback rather than the endless teaching. And this is in the educational literature. And I'm kind of a sports nut for people who may or may not know me. And this guy gives a lot of examples from learning how to hit a tennis ball, swing a baseball bat, those types of things where feedback is not just verbal, but it's also visual. So I like those examples a lot. And I have a copy of it. I'd be happy to share that with you. And then I don't think there's any evidence involved in this statement whatsoever, but Bill Gates seems to think that we all need to have people that give us feedback because that's how we get better. So that's sort of the basis for what we're thinking about. So what is it? When I say feedback, what do you guys think about? Just blurt out what you're thinking. No thoughts?
It's how you're doing.
How you're doing. Good.
Summative or evaluatory.
Okay.
Good guidance for improvement.
Perfect. Good. I kind of think it as this. Here's a mirror. Here's what I'm seeing. So I'm just holding it up so you can see what I'm seeing. So it's about sharing observations. So things that you've actually seen with this learner or colleague. Perhaps I have some scenarios about colleague feedback, which is an interesting experience. It is meant to be formative, right? So this is meant for me to give you feedback so that you can hear what I'm thinking and think about how can that be done better or differently. And it's timely, ongoing, not 3 months down the road. 3 months down the road is not helpful. It's not about you as a person. It's about a specific observed behavior. There's no judgment involved. It's merely reflection. And it gives you an improvement before evaluation. So I'm really happy that you said those words like formative and evaluation, because I think it's important for us to just spend a little time talking about the differences. And then we're talking about behaviors that people can control and that can be changed. So a very common issue that comes up is feedback versus evaluation, right? So the timing is different. Feedback is ongoing, it's happening in the moment. Evaluation is at the end. Feedback is between you and I. This is what I'm seeing, this is what you're doing. Evaluation is more about expectations that are established. We expect a medical student to be able to write a complete H&P, just as an example. And the feedback that I'm giving is about things that are happening between us that I can see in order to help you to improve, whereas evaluation is just kind of looking back at the whole thing and reviewing the performance. Both of them, to be fair, are best accomplished in person. I would say that both of them commonly are not accomplished in person, but I think they're most effective. Verbal conversations I find very helpful. And, feedback sessions are very descriptive about things as opposed to evaluations are obviously documented and written. So just to clarify, I commonly hear conversations where feedback and evaluation are used interchangeably, and they're actually two very different things. So just to help me understand this audience, who mostly teaches medical, I'm not going to say that, who teaches medical students? Who teaches residents? Who teaches on the inpatient service? Who teaches in the outpatient setting? Okay, fantastic. You're a very pluripotent group here. This is great. Okay, so let's just talk a little bit about approaches to effective feedback. And who's ever heard of a feedback sandwich? Okay, so we're gonna give you a different structure, but a similar structure to a feedback sandwich. Okay, so one of the key things, which is really pointed out well in that paper that I talked about from the educator, is about expectations. This is the part of feedback I think is most commonly left out of the equation. And these are generally, educators will share their expectations with students. It's not as common, for educators to elicit expectations from the students. What is it that you want to get out of this? Just tell me. So we don't generally take the time to do that. Why? Well, we'll talk about that. We don't generally take the time to do that. So it's really important to have the learner engaged into what it is that they want to get out of whatever experience it is. An afternoon in clinic with you, a 1-month inpatient medicine rotation, a NICU rotation, what have you. And then once you have established that relationship and you're getting to the point that you're going to give feedback, it's important to prepare people for the fact that you're going to share this with them. And one of the things that was pointed out in the paper is that even though we feel like we're clear, medical students often don't recognize feedback without us being very clear about it. So you can say something very simple like, this is feedback, Jason. Or, is it okay if I give you some feedback about that introduction? Right? So now I'm being more polite, not just saying this is feedback, but rather, hey, is it okay if I give you this feedback? So now he actually hear the word like, oh my God, she's going to give me feedback. One of my many frustrating experiences is I'll sit down and talk with a medical student and say, well, okay, we're going to do some feedback. And I sit down and give them some feedback. We just go through this whole conversation, and they look at me and they're like, thank you so much, Dr. Dewar. I really appreciate you taking the time. Do you have any feedback for me? And then I get hypertensive and have to take some deep breaths. Okay, so as opposed to the feedback sandwich, I'm going to propose a different type of sandwich where the ask is the bread. So you're going to ask, you're going to tell, and then you're going to ask again. So what am I talking about? So the first thing is ask your colleague, Jason, how did that go when you introduced me this morning? Give me some feedback about how your performance was. So now I know where the learner is, and then reflect back to them. This is where the part where you tell them what it is that you saw. I had a really interesting conversation with a resident the other day where I asked her how she was doing with organizing her thoughts and presenting concise presentations. And she said to me, oh my, I'm basically on the pretending level. Okay. So that was helpful for me to then reflect back to her that in fact she was not. And this is the reason why. So it's really helpful to have that insight. And then when you are doing those conversations, focus on actions that you've actually observed, rather than any kind of assumptions about what you think people mean or to do. And you'll see there is a wide array of things. Think about it. You're at a bedside with a patient. There's probably about 1,200 pieces of feedback you could give to any learner in that room. And the key is, to select those ones that hopefully go with the goals of the learner. And it may or may not be helpful to prioritize the ones that you choose depending on the severity of the need for improvement. And then you go back for the ask. Okay, you thought that. I saw this. What do we want to do about it? What's the next step? So that's when you engage the learner in a plan to move forward and see if there's a way to come back and engage the improvement. So that's the new sandwich. Ask, tell, ask. So, without giving feedback, people may assume that all is well, or they may assume nothing is well. They may assume they're doing horribly. We don't reinforce good behavior, and then there are mistakes that potentially go uncorrected. Okay, so so there you have it. What's so hard about that? What did that take, 16 minutes? 16 minutes. Done. Now, seriously, what's the problem? What are the barriers? Tell me why are we not giving people feedback? What's so hard about this?
It's hard to give constructive criticism, I think, sometimes.
Why? What's so hard about that?
Because I think people are worried about hurting them.
I don't want to hurt their feelings. Okay? Why else? You're so sweet.
There's a fear of conflict, too, if you're not sure how it's going to be received, and that's uncomfortable.
Don't like conflict.
Time.
Time, right? It's like the gigantic, monstrous elephant in this room, right? Who has time for this? Seriously, this takes a lot of time. What else?
Sometimes you're not sure if your impression of the situation is fair, if you have enough data to support your observations.
Especially when they need to improve something, correct?
Right, so if you've worked with 10 patients, it's going to be easier than if you've worked with one and it was a one-off or the patient was challenging.
Fair. Excellent. So you don't want to be too quick.
Right.
Good.
Maybe in your eyes they're doing so well that you're like, just keep doing what you're doing.
Exactly. Right.
I
Good?
think there's a lot of nuance in what we do.
Mm-hmm.
And I always think about that old expression, there's more than one way to skin a cat. So your approach to patient care and my approach to patient care are different, just like your approach to interviewing or examination is different. So I don't necessarily want to make you have my approach. It's probably not work for you.
Right. Fair enough. Okay. Excellent. Oops. Okay, so we talked a little bit. I don't want to be the bad guy, right? I don't want to upset people. I don't want to make a big deal out of it, right? Maybe it was just a bad day. One thing. It's interesting. Sometimes the interns get very hesitant about giving feedback to the medical students. I mean, I had an intern say to me at one point, "I don't want to ruin her career." I'm thinking, sweetheart, do you really think that you have the power to ruin someone's career? I mean, seriously, just tell her to write an organized note. How hard is that? So, I mean, it's interesting. People feel this is a huge deal. Anyway. And then this is an issue we can get to when you need to give feedback to someone who perhaps might be at your level or a little higher level than you. Like, I don't want to, like this is why residents don't give us feedback, right? Because it's a little intimidating. Maybe you're part of the problem, right? Maybe you made that medical student present that really complex patient at the bedside. Maybe this problem is all yours rather than the student or resident. It was, this is one of my favorite. Obviously, that wasn't the way to give that presentation at the bedside, right? I mean, when someone gives a presentation and there are 42 questions from the family or the attending, in my mind, that goes without saying. That was an incomplete or unclear presentation. It doesn't go without saying. That learner needs to hear that was an incomplete presentation. Clearly, we didn't understand. There was a lot of things left out of it. It's too late, which sometimes it can be too late, but it's never too late to give feedback about things that you've seen. Don't like confrontation. Not enough time. Not enough time. There's not enough time for all the things. Well, I won't even get into that. That's a whole other talk. Okay, so here's a little lady who's giving some feedback. Right? It's timely. It's clearly about that window. I think it may be about their outfits. It's hard to say, but she's right there and giving those guys some feedback. Good job. So it takes time. So the key is to do it. Schedule it, say it, make it happen. Set objectives at the beginning, ask your learner how things are going, focus on their behaviors, so name things and be very specific. And then make it timely. Don't wait. Okay, so we are going to, let's see, how much time do we have? Great, we have lots of time for role plays. This is fantastic. So the room isn't set up very well. Just kidding, no role plays. Now I have some videos. So I have, I know that was great, right? So I have some videos, and we have 4 different scenarios that we'll go through. I have feedback to a resident, feedback to a medical student, feedback from a chief resident to a resident presenting morning report, and then feedback from a chief resident to an attending physician. So 4 different scenarios. Think about what we've talked about. We're going to talk about each one of them and see what went well, what didn't go well. Okay? So let's start with feedback to a senior resident on an inpatient pediatric service. At the beginning of the videos, I play the attending. At the end of the videos, I play a resident, and then I play an attending. So it's great. So I'm in all of them, but I have different roles. All right, so this first scenario is faculty feedback to a senior resident not done well. So pay attention. Okay, Katie, it's the end of the week, but do we have some time we can do some feedback?
Actually, clinic today. Is there another time that we can do it, or
really, I really can't talk right now.
Okay, sure.
So, I thought it was a great week. I thought you were a fantastic senior resident. It was really, really well done. I really enjoyed working with you.
Oh, okay, thank you. Is there anything that you think that I could work on in particular? Because there are definitely some moments where I don't feel like I'm the expert of the team, and I'd like your insight to whether it's knowledge base or, even just leadership, anything in particular.
Well, I did hear from the interns that they probably needed a little more help with you putting orders in. But that was really the only complaint that they had about your scenery.
Oh.
So I thought it was really a good.
They didn't mention that to me.
Good week. Well, maybe you could talk to them about that.
Sure. Anything I need to change for next week, knowing that a new attending is coming on? Any expectations that I should set?
I think you did a great job.
Okay. Well, thank you.
I really enjoyed working with you.
Yeah, it was a pleasure.
Fantastic. Okay, so how did that go? What went well?
You were together. You sat down.
It was verbal, right? We were together.
You asked for her input.
I asked. It was pretty timely, right? Like it was so timely. It was too timely. It wasn't even good time. Good. I did say feedback. Very good.
It was definitely non-threatening.
Totally non-threatening. Bordered on annoying, right? Okay, so what was not so? So that's about it. What was good? What was not so good about it?
There was nothing specific.
I gave her.
Whether it was good specific or bad specific, it was very overall impressions and nothing, particularly even when she asked, other than helping teachers put in orders,
which was hearsay, quite frankly, right? That was not even. I didn't even observe that. I just heard that somewhere. Right, so it was very non-specific. The timing was not so great. I didn't do as good of a job getting her input, but, I really didn't. This was a perfect example of what you had said earlier about, hey, it was great. You did great. Great. Okay, so let's try it again. Okay, so this scenario will be faculty feedback to a senior resident done better. So pay attention. It's Wednesday, and we talked Monday about your goals for this week, and I just wanted to take a couple of minutes to give you some feedback about how things are going.
Great, yeah, that's perfect.
Wonderful. You had mentioned on Monday that you really wanted to step up and do some teaching during our rounds, and I just wondered how you thought that was going.
Yeah, definitely. Especially as a third-year resident, I want to try to, bulk up my knowledge base and be the teacher for the residents. I don't know. I'm still struggling with that a little bit, especially on a subspecialty service where I feel a teaching point on rounds, I either question myself or I'm looking to the fellow, or I notice that the interns are looking to the fellow, and then I guess I don't really know if there's a role for me. And so, maybe it's just maybe I just need to work on my confidence, but I have a hard time kind of finding where my teaching role is in the rounding setting.
Okay, well, I mean, that's an interesting point. I guess that is probably not an uncommon challenge that you guys have. I will say, however, I've been impressed, completely separate to that, is the fact that you know the patients really well. You know their medical issues very well, and because you know them so well, you're able to kind of guide us and keep us on track during rounds. So I have found that to be very helpful. I don't know if you're aware of that, but I can see that we're much more efficient. How do you think we could work on getting you involved in the teaching more, or making a better role for you on this team?
I don't know if maybe it would be helpful to have 10 or 15 minutes of dedicated teaching time at the end of rounds where, I don't know, something simple like I go over a prep question and have you there for, as more of a additional support layer if I have a question. But then to have me lead it, and that can be, just my time to talk to the interns, but to have you supervise to, jump in if you think I say something wrong, or if, if you want to add some more information.
Okay, well,
so I really like prep questions, and I feel like that's something that I feel a little bit more comfortable with than, for example, being the point person or the expert on hypertension. When we talk about
well, that's a fair point. So we can carve that out maybe at least one day this week to do a question. And how about also when we're on rounds? I mean, if I actually turn to you for general peds teaching points, I can kind of just let you.
Sure, that would be great. That would be great.
Then that'll make you the general peds expert.
Because that's definitely what I feel more comfortable with, and that's very. I like that.
Okay, perfect. So we can chat again maybe after rounds on Friday and see how that goes.
Yeah, perfect.
Okay, well, great. Thanks.
All right, thanks, Dr. Dewar.
Okay, what do you think about that?
You did the ask, tell, ask.
Way to pay attention. How did it go? This is what I saw. What are we going to do about it? Great. What else?
You also asked what our goals.
I don't know if you paid attention, but I had a card there because I can't remember anything. And that was Wednesday, and clearly we had talked Monday, so I made sure I wrote those things down. So 2 days later, I remember what you told me. Because you know as well as I know, you got a senior, 2 interns, a couple of medical students. How are you going to remember everybody's goals? So I reflected back to her goals. Excellent. What else?
The feedback you gave her was behaviorally based. It wasn't just the impression, great job. It was, you know the patients really well, you're efficient, and helped us move.
Right, which had nothing to do with her goals.
Right.
Nothing. The other thing, exactly. I reflected back very specific things I had noticed. Because clearly I hadn't noticed her teaching at the bedside.
Yeah, that was one of the negative things I noticed. So when she asked you specifically, how can I get more involved in teaching, the next thing out of your mouth was talking to how much the patients were saying absolutely nothing. It seemed like a deflection, which is easy to do because a lot of times you have your script in your head.
Right.
You go through the script, so it's easy to deflect them. But you did come back to it.
Right.
You know?
But I didn't really like her answer, did I? We're going to do a prep question once a week. Okay. How about also we do this other thing, and then...
Well, so that was my question. So I was thinking about whether I would have asked her what she wanted to do or whether I would have made it multiple choice instead of short answer.
Yeah.
Because sometimes when you ask, you don't like what you get.
That's exactly what happened.
Right. And so then I struggle a little bit with feeling dismissive.
Yeah.
So I'm more of the ask, tell.
Okay. As long as you can embrace your behavior.
Because I don't always like when I get on that list.
Exactly. Yes.
You didn't actually tell her you thought that was a bad idea.
I did not.
Yeah, and it was a bad idea.
I agree.
And so, I think, something along the lines of that might not be the best thing to do in this particular particular
Right.
setting, let's look for
Let's
something
talk
else
about
as
another-
opposed to, well, we can do, maybe we'll do that a little bit, even though I think it's a terrible idea, but, let's do this other thing that I think is a good idea.
So I could have been more clear.
Yeah.
I could have been more clear. Great.
Might have stated it a little less.
Yeah.
Nice,
So I asked about her. Yeah. That's that uncomfortable thing, right? Where it's like, oh God, that's so horrible. So, you have that inner thing happening and you only can let certain things out to keep engaged with people. So, okay. So, let's change it up a little bit. Now we'll go to a medical student. There's just a plethora of feedback we can give to medical students, right? God knows they could learn all sorts of things. This is faculty feedback to students not done well. See, it takes all the mystery out of it.
So, but I wanted to take some time to give you some feedback. There's a couple things we can talk about.
Okay.
So, listen, your progress notes are not written, very timely. I mean, you're signing these things at like 4 in the afternoon, and they're disorganized. They're hard to follow, they're not really very good progress notes.
Okay, I'm sorry.
Yeah, the thing is that, and the other thing about that is the differentials. I mean, there's just no differential diagnosis in the note.
Okay.
And then, when we're at the bedside, I mean, your presentations are about as disorganized as your notes are. Unfortunately, we've talked about the SOAP note and the subjective objective assessment plan, and I don't ever kind of hear that from you. I'm not sure my parents understand you. The way the language that you're using, could be a little easier for them to understand. And then I know you don't have all the patients, but you need to help get the nurses into the rooms on the other patients.
Okay.
So, there's a fair amount of things to work on moving forward.
Okay. I'm sorry.
Oh, no, there's nothing to be sorry about. I mean, I think it's important, we all want to get better at what we're doing. And I mean, this is, about half a dozen things that you can work on.
Is there, should I do focus more on one instead of?
No, these are all pretty important, right?
Okay. Okay. Well, I'll try and do better next week.
Yeah, that would be good. That'd be good.
Okay. Thank you.
Sure.
Okay, so how'd that go?
You did call it feedback.
I sure did.
There was a lot of specifics.
Very specific.
Just it was too many things
Right.
for her to work on.
Right.
And no action plan about how to get better. Like, obviously, she's maybe trying as hard as she can, so if you
Right.
just tell her to keep trying, she's not going to match it.
Right.
There's no priority within all of that.
Right.
Actually, although it was specific, it was not specific at the same time. Like, your notes suck, your differentials suck.
They're horrid,
It's
yeah.
not helpful.
Yeah.
You would have done a sports analogy. It's like when you get to the plate, your swing sucks. Okay.
You missed the ball, yeah. Great. Help me hit it.
So I'm probably going to be the one person that disagrees. I mean, I think the lack of priority was a problem,
Mm-hmm.
but I think there are some students that need to be told, you're just not meeting the bar. And by telling people you're not meeting the bar, for some of these people, it's the first time they've heard that.
Yeah.
And it scares the hell out of them, and then they come back a week later and they're a lot better. I mean, I've had that experience.
Right. We've all had this student, right?
But there's some people that just need to have, like,
If you
horrible
think she's
feedback
not
provided to
if
them.
you think she's not
and change their
motivated,
behavior.
then yeah. But if she's clueless and doesn't know what to do, that's not helpful. Like if I say, Greg, you couldn't throw a fly line if your life depended on it, that doesn't help you,
But we're not getting a lot of students here that are clueless. I just don't see that as the problem.
Right. So to be fair, she had unstructured progress notes and unstructured presentations, which in my mind go together, right? If I can bring that structure, she needed structure. She also needed language with, speaking with families. But the thing about getting to the nurses at the bedside, that, I could have done that on rounds. Like, hey, Beth Ann, call the, that's silly for me to, I think, in this session. But the key focus, I agree with you, she needs to work on her organization. No question about it. But, like you said, that, you know, I could give her a little more structure about
You
it.
brought a note in. They had a good
Exactly.
You know, so here's how it should.
Let's look at this. Right. Yeah,
So
exactly.
I'm a little more in Greg's camp on this one, because I have to say that, I think ideal feedback would have been the attending brings the note in, you go over it, you talk, but oh my God, you know, like that, the feedback you gave while it was a little
Harsh.
rough,
Mm-hmm.
give it a rub. It's probably the best feedback that kid's gotten in 6 months of being on the board, because you were direct. So I actually didn't think it was that bad. It is an interesting question about whose job is it then to fix an issue that's
Right.
delineated.
But I think there's a difference between pointing out that you're clearly not meeting expectations and delivering that when students need to hear it, but also giving them some context for, I'm not meeting expectations in multiple realms, but where do I focus my time, effort, and energy? But I think you could summarize, you could say, like, you know, as we talked about, like, the needed structure, which actually applies to both the notes
And the presentations,
Say,
exactly.
you know, you're not meeting expectations in your notes or your presentations. This overall, I think you are lacking an organized structure to how you present things. So we need to work on how you structure your notes and your presentations, and that gives her. It very much says you're not. So rather than being like your notes are terrible, your presentations are terrible, it's like a bigger picture of how.
I mean, I agree. I agree with you completely. It could have been packaged better, but I don't think I would not frame that as done badly.
Oh, I would. You know, this is like.
Well,
if you go to the sports analogies again, right? McCutcheon right now sucks, right? And if you go to say, look, we pay you $10 million, and we're not paying you $10 million a year, it's back $220, right? You know, and your salary is going to get cut. You're a terrible batter right now. That is not helpful, right? What's helpful is your stance in the box is bad, your swing is choppy, and one of the things we do wrong, we mix evaluation and feedback. This saying you're not meeting expectations is an evaluation, it's not feedback. Feedback is you got to put your stethoscope next to the skin, not to the shirt. You have to stand on the right side of the bed. Those kind of things are feedback. Here's the way a note is supposed to be constructed.
Right.
That is feedback.
So I never. So the point that what I'm hearing you say, Missy, is that the fact that I pointed out her deficiencies wasn't bad. I feel though I did overwhelm her.
I'm not saying it was perfect. I really because I think there are opportunities. But I want to say that I would say that's better feedback than 90% of our faculty.
The no feedback. Right. At least she realizes there's a problem.
That's right. You're doing fine pass.
Yeah.
Right. And I'm like,
Right.
The other comment I want to make is that one of the barriers we didn't talk about is that when you have a student like this, is that pressure to actually then fix them.
Yeah.
Which is very time-consuming.
Yes, exactly.
Right? So you know, I would like to think on a good day, I would have brought the cards and gone over. What I might have said, I might have been like the general manager referring to the batting coach.
No, exactly. Talk to your intern.
Talk to your senior. What I need you to do is pay attention to the intern. I need you to present to the resident before, which is still a strategy.
Absolutely.
But I get anxious with the sort of attending having to own all of the corrective measures.
Right. Hands on.
Yeah.
I would raise the issue that if this student is as bad as they seem to be, that this is way too late. You know, to have a meeting, I don't know when this is, like at the end of the
it's Wednesday because it's Friday because I know from Monday, so it's one weekend.
So, you know, I think you doing these 7 things wrong would probably be better packaged as after rounds, that presentation.
Oh,
X.
absolutely. Right after that, when she said febrile, and the mother kind of looked, outside that room is when I tell her that. Outside the room is when I say you need to help us get the nursing room, right? That's those. Yeah.
So Steph, here's the question, and this is one of the things that we struggle with this group. Do you give her that feedback in front of the rest of the team?
So this is such a great question and such a polar response. I am in the camp, so here's how I approach this. I like to do group goal setting at the very beginning of the week. And in that session, because it's helpful, it takes less time for me than to meet one-on-one with each of them, right? Because like I said, I've got a senior, 2 interns, and 3 medical students at 6 people minimum, and an AI that's 7. We do group goals, I tell them my goals, and then I ask the group permission to do just what you said. Is it okay if when we're on rounds, something happens, and I feel as though it's a great learning opportunity for the group? Would it be okay with you, Jason, if I pointed out constructive criticism to the group? Now, they don't really know at that point what they're agreeing to, right?
Does anyone ever say no?
Yeah, I have. And that's okay, I respect that. So that's when we leave the room and I just kind of walk over there with Jason and we talk. And that way it's not in front of the group, but it's timely. So the one thing I failed to mention, we've watched 3 videos now, 2 not so great, 1 better. How much time did those take, those sessions? How much time?
Probably like a minute and a half, 2 minutes.
Yeah, the middle one, it took like 2 minutes and 45 seconds. So at most 3 minutes, really, in the greater scheme of things. You guys are going to sit here for about 15 minutes, 15 minutes, a long time. So it's not a long period of time. And some of those things I could have done. So I do it because I feel that there's value in that. Sometimes I'll walk out of the room and I'll say something like, wow, what just happened in there? Because I think it's really useful to debrief the conversation that just happened with the patient because of whatever. Someone said cancer, and the grandmother fell to the floor, or what have you, and then we can talk about, like, okay, how could that have gone better? Or whatever. That doesn't usually happen on rounds, but, okay.
Grandma falls to
That happened with, she's pregnant, and then, grandmother fell to the floor. It's like, okay, this isn't going well. Let's try this again.
This is faculty to medical student feedback better.
To be fair, she's not as bad.
So, Beth-Ann, we had talked on Monday about what you wanted to work on this week, and you had told me that you really wanted to get more comfortable with your presentations at the bedside.
Yeah.
I wonder, how do you think that's going?
I think overall it's going pretty well. I think there are still some times when I maybe slip up and I'll use medical jargon in front of the families, but I'm just trying to be a lot more mindful of that. And so I think overall it's definitely going better than it had been going.
Okay. So I think you've done a lovely job making eye contact with the family, and really gauging how they're receiving the things that you're saying. So even during those times when you say something like febrile or NPO, because you're looking at the mom, you can see that you need to change that a little bit so she can understand that. So you've done a lovely job with that. I have noticed a little bit, though, that you have a tendency to kind of go straight to the plan without, kind of taking the time to go to the assessment just to clarify what you're thinking. I mean, I have noticed in your progress notes that they're very organized, and you have a lovely assessment and then your plan. So, I know that you know the assessment. I think it's just a matter of being sure that we're, clear with the family and what we're thinking about what's going on.
Okay, thank you. I'll definitely make sure to work on that moving forward, and maybe we can meet again, maybe next week sometime, and you could let me know if I've been able to fix that.
Sure. And then also, right after your presentations, we can chat really quickly and say how that went.
That would be great. Thank you.
Perfect. You're welcome. See you tomorrow.
See you tomorrow.
So clearly she responded to my feedback from the first week because her notes are better, right? But now she's still not quite great at the bedside. So things you noticed there that went differently?
You asked for her opinion first.
Yeah, I did. I never asked.
It made it a little bit easier to give her feedback because you had a starting place.
Yeah, exactly. And then we made a plan to revisit what to do. Okay. Should have really redone it with her being as horrible as she was previously. Okay. Now we're going to change it up a little bit. We're going to do. You can ask as many questions as you wish. So happy that you're here.
The other thing that happens is with the other. I'm about to get to the tell approach. when you ask how it's going and they're totally off,
Yeah.
how do you handle that? Or their assessment is,
Yeah.
I'm doing fine.
Yeah.
Well, actually, you suck.
Yeah. Yeah, right? So how do you have that?
So I find it asked to be, I always do that. I always say, how do you think it's going? And I never get anything where I get student stuff that derails me.
Okay. So that happened to me. The person who told me she was functioning at the pretending level when she was an intern. And I, to be fair, it is
pretending.
Yeah, like she's like ready to be an attending.
Oh, I thought she was pretending.
She's like ready to take that next step to be an attending. And she's like, I'm not sure she's ready to be a second year. So, I mean, I think it's important to engage them, right? You at least give them a seat at the table, rather than assuming that they're going to say something not useful. Because it may be someone who comes clean and says, oh my God, I'm still struggling like this person. I'm still struggling with X, which is helpful. Then you can go to that. If they come back with that, oh, I'm functioning at the pretending level, I'm totally organized, then I understand where the person is, because I'm going to give her some very different feedback. Well, I'm glad you brought that up, because other people, including myself, have noticed very different levels of performance. I find it helpful to frame the next conversation.
I've come up with a way of never digging myself into that hole, because if you ask how are things going, then you could always get, I think things are going great.
Oh, I get that.
Even if they're not, right? So I never ask how are things going. I say, and I preface it by saying I always do feedback this way. I say, I want you to tell me 2 things that you're particularly proud of that you've been able to accomplish so far this week or this rotation, and 2 things that you are going to set as challenges to improve upon in the next week. And then that way it forces them into giving me 2 positive things about themselves and 2 negative things about themselves. And then I would say like 75% of the time, the things that they said as challenges are the things that they're not doing well that I was planning on giving them feedback on anyway. And then it makes it easier for me because then it's like it came out of their mouth. It didn't come out of my mouth.
And it's similar because, I don't know if you paid attention, I actually reflected back to her and said, how do you think it went with your presentations? Because that's what you told me you wanted to work on. So I don't usually give that global.
Listen open.
We're meeting about this thing that we agreed upon before.
The circle.
So it's not as, wide open as that. It does take time. It doesn't take that much more time to do that. All right. Can we change gears now? Now we're going to do not a great morning report presentation by a resident. Me. And our current chief resident is going to be the chief resident. I just want to point out a couple of things. I love
very eager stuff.
I love Hello Kitty. And I love Jim Dewar. Okay, here we go. Obviously, this is my office.
Steph, I wanted to give you some feedback on your morning report presentation. Right now? Yeah, so I just wanted to let you know. I have like hemo rounds, and we have like 25 patients. Okay. I just wanted to let you know you just didn't sound totally professional, and I need you to act more like a doctor. Is there something in particular that you're talking about? I'm not sure I understand. Not really. Just in general, like the way you present. Okay. Thanks.
Okay, how'd that go? What went well?
Not much.
It was timely, but once again, not a great time for me, right? What else? She did say feedback. She said, I want to give you some feedback about your morning report presentation. Whoops. So it wasn't optimal timing. She didn't really give me much option, right? She didn't really prepare me for it. And she didn't ask me anything, right? She just told me you're unprofessional, which was, really not very specific. Like, great. What does that mean? Now I'm just angry.
Okay, and there was no plan. All right, let's see how this could have gotten better. So you don't even know what happened, right? You don't have any idea what was wrong with my presentation. You're going to find out. I love the Steelers, too. Just so you know. It's a window into my
So
world.
what if I gave you some feedback on your morning report presentation?
You want to do that now?
I know it's almost time for rounds, but I only need about 2 minutes. Would that be okay, or would you prefer to do it later?
Okay, I mean, at 2 minutes, I think I could probably manage.
Okay. So how do you think things went today?
Well, I got a little caught up in the lab results. I forgot the glucose in the spinal fluid. But other than that, I thought it was a really interesting case, and there was some great discussion.
Okay, yeah, I think it was an interesting case too. I wanted to give you some specific feedback on one point in your presentation when you said that the outside hospital didn't even do a lumbar puncture on the baby. And
yeah, they didn't. They said
right. I remember you saying that. From a listener's standpoint, though, it did sound judgmental when you said that.
Oh, well, that's fair.
It's just important to keep in mind because we do have medical students and interns in the room who are looking to you to model professional behavior.
Oh, okay. Well, that's a fair point, actually.
Is there anything you could do differently for next time?
Well, I mean, I guess I could pay attention more about kind of transmitting my interpretation of how things go at outside hospitals and be a little more supportive of our colleagues, I guess.
Okay, yeah, I think maintaining objectivity is important, and that's definitely something that you can try to do moving forward.
Well, so I have another case that I'm going to present Monday that actually was also seen in that outside hospital. So how about if you're paying attention to those comments that I make about the work up there, which actually also wasn't complete, and then see how I did.
Okay, yeah, I'd be happy to listen next week and give you feedback on that.
Great. Thanks so much.
Okay, anything else you wanted to discuss?
I don't think so. I gotta go though.
All right, have a good day.
How did that go?
You're such an insightful president.
Well, she called me on it, though, right? She called me on it.
She did a good job because she gave the specific example.
Yeah.
She was straight to the point.
Yeah.
She gave you a reason.
Yeah.
She kind of got buy-in with the medical student hook, which seemed to resonate with you.
And I owned it. To be fair, I was a resident who owned the fact that I had a tone about them not doing a spinal
But you
tap.
were able to own it because she wasn't judgmental when she just gave more objective feedback.
Yeah.
That you were not professional, which is pretty negative.
Right, which is really damning. Like, well, who's going to listen once you say that? Like, what do I care what you think? That's so global. But this one thing, because we've got learners in the room, I needed to do a little bit better job with that. So she did ask me how I thought it went, and I was, who cares? Well, anyway. So it was very specific, and then we problem solved together. And she also kind of tweaked my problem solving, right? I was talking about being more supportive, and she's like, well, yeah, but, just present things objectively, which is also fair.
The other thing that I would maybe force the learner to do is just restate the way that it should have been restated.
Nice.
Like, that it should have been stated to begin with.
Nice.
Which is a lumbar puncture was not performed in the outside hospital,
Period.
Just to make sure that they are clear about how I would have wanted it to be stated.
Right. Very fair. Very fair. Very common. This is a very common point of feedback that we can give to residents and students, which really makes me cringe because when I hear the students doing it, I know that's a learned behavior, right? And shame on us for allowing that. Okay, so this is a little different. This is giving feedback up. This is a chief resident who's having a conversation with the oncology attending about inpatient rounds. Okay, so this is that really uncomfortable feedback situation where you're worried about things.
Hi, Dr. Dewar. Thank you so much for meeting with me today.
Oh, Regina, I'm so happy that you're here. I understand you want to give me some feedback about rounds. That's so great. We never get any feedback.
So what I've been hearing from the residents is that they're not making it to June conference.
Yeah. Well, we that's quite true.
I understand that. They still need to get to noon conference, though, as their protected education time.
Well, so they're learning. I mean, they don't know anything about treating cancer. I mean, there's so many medications and side effects. I mean, it's not like they're not learning.
Okay. I mean, I'm sure they're definitely learning, but there's other things they need to learn about besides oncology.
Really? I mean, it's really important. You know, I feel bad about your new conference. I don't really know what else I could do.
Okay. It seems like we're going to have a disagreement here, and so I'm just going to bring this back to Dr. Nowak, and then we'll talk further from there.
Ooh, okay. Thanks.
So what went well there?
That's an assertive cheater, isn't it?
Yeah.
Right?
I think very few residents would do that.
She wasn't very diplomatic.
No, she wasn't.
She was specific.
Very. Right? They're not getting to noon conference on time. I was excited about the feedback, right? Until I heard it. What else? I mean, that's really, you know, about it. So she was, what else went poorly?
There were no recommendations for improvement.
Well, I kind of think her goal was for me to get the residents to noon conference, right? I mean, it was sort of not stated very clearly.
There was no second ask, like, how could we do this differently?
Right. She didn't engage me at all. And didn't, I mean, I sort of told her what I thought, right? They need to learn about treating cancer. They don't know anything. I'm teaching them. But I didn't feel engaged, right? I felt threatened, actually. She's going to call on Andy Nowak, for God's sakes. I mean, holy moly, that's terrible. So, yeah, that wasn't good. And we had no plans made for improvement.
It's hard to make plans for improvement when the person is not receptive to the...
Exactly.
Right? I mean, and, you know, this is a different situation because all the other clients you're working down.
Correct.
You say, look, you have. I don't care whether you want to or not. Ultimately, you have to do. What I want.
Correct.
And other than going to her boss, there's not much. So I don't know how she could have engaged her in improvement when she says, "I'm not going to change this."
Right. And that was the problem,
That's
right?
being said.
This was confrontational.
Yeah.
This was we were never on the same side of this issue.
Right.
So let's see if she does better, getting me on the same side of the issue.
Dr. Dewar, thank you so much for agreeing to meet with me today.
Sure, Regina, this is great. I mean, to have a chief resident take the time to come to give me feedback about my teaching, I really appreciate that.
Oh, I'm happy to do it. How are things going on oncology?
Wow, what a week. We've had the most interesting patients, pretty unusual conditions, and real wide variety of different medications.
So she just engaged me, right? I'm excited.
It's just endless.
Great. We've actually heard from the residents that they're really enjoying it.
Now she's buttering me up.
I did want to be concerned to you, though. We have noticed that they are getting to noon conference late. And what it sounds like is that rounds are finishing up around 11:30, but then there's a teaching session that tends to run into the middle of noon conference. And so they're coming in the middle of the talk, and they're missing some of that content.
A little more specific, right?
Extra time at the end of rounds to go over the medications. As I mentioned, we've had a lot of different ones. I think it's so important that they know, the risks and the benefits, the side effects.
Can't argue with that.
Understand what's happening with the patients.
Yeah, and I want to reiterate that we really appreciate that you're taking the time to do that.
Buttering me up some more.
I want to think with you about a way that we can round on the patients and also get that didactic teaching that you're doing, but also get the residents to do conference on time. So how can we accomplish that?
Well, depending on the number of patients, I guess there is some time between patients that we can have those conversations. It's also not unrealistic to have those conversations at the bedside with the patients and the families so that they understand
What a great idea.
what they're watching for. They might actually appreciate that. So, I guess I could probably do that, still give them the information and probably get them to do conference on time.
Okay. Yeah, I think that sounds like a great plan.
Okay, so today's Friday. I feel badly about this group, but maybe, you know, I'm on service again in 3 weeks, and maybe I'll give that a go.
Okay.
And we could touch base again and see. I'll even talk with the residents about how we're going to change that teaching up a little bit.
That sounds great. Why don't we plan to touch base in the middle of the week of your next week on service, and we'll see how things are going then.
Okay, sounds good. Thanks again.
All right, you're welcome.
So to be fair, that's my dream conversation, right? With a teaching attending. I mean, that's not an uncommon problem that we have. And I'm asking for a major change in their workflow, right? I'm taking them away from that lecture room to actually engage the learning at the bedside with patients and families and the learners. That's a huge culture shift. So that's a little pie in the sky, bit of a conversation. But I mean, there were things that went better there, right? I mean, I was kind of pointing them out as we were going along. So she did ask me, right? She asked me how things were going. I got so excited. Oh my God, there's so many sick patients. It's so amazing. And she reflected back very specifically, I'm not getting a new conference, but wow, the teaching's really good. Then we were sort of walking together as opposed to slamming heads so much. And then even though it was too late for that group, we made a plan to change my behavior perhaps. And honestly, I will tell you, this is a very common struggle that we have in the program. So I don't know if it resonates with you. Any other comments about that? I know it was my ideal. I was answering in a way I wished every attending would answer that conversation, which they don't.
But the only comment I'll make is that the chief didn't back herself into a dogmatic corner.
Right.
Even if the attending had not been the perfect attending, she did not, I mean, you know where she would go if the attending was less responsive, but she hadn't started so adversarial. She gave herself options.
Right. Exactly. We had a conversation. We were engaged. We were talking about learning. We had the same goal. Okay, so I'm going to wrap it up there. I just to remind you what we talked about. The key is the setting of expectations, which I think is the thing that we commonly don't take the time to do, and then being very timely, expected, clear, and reasonable. Ask, ask, and then make a plan for follow-up. I get it. There's not enough time in the day for all the things that we want to do, but this really takes minutes if you are really thoughtful about how you do it. I sort of let you into my world of not being able to remember things, and one of the things so I have a tendency to write things down so I can remember what learners' goals are. The problem is I found sometimes I misplace those things. So that's not very helpful that I don't have my card that I wrote down when it comes time for feedback. So I'm now obsessed with learning how to use OneNote, which is on my iPad. It's like my new favorite thing. And if you don't know about it, I'll be happy to tell you about it. But the other thing is I have it on my iPad, which I have on rounds with me, which I can, pull up x-rays and show to families and that sort of thing. But if I'm in a room with a student or resident who's presenting, I can pull up my notes about them and document something like, if you say febrile one more time, I'm going to have a seizure, or something like that to remind me like what I'm thinking. So that when we sit down at the end or whenever we're going to do it, I'm going to share one of my probably least professional feedback sessions I ever had very quickly at the end, but it turned out to be the most effective. I had given an intern feedback about something. I can't remember what it was. I have no idea. This happened 4 years ago. He continued to do the thing the way I recommended he didn't do it. And on the third time he did it, and you asked a question about constructive feedback in group, we came out of the room, and this was the third time this had happened in about 3 days, and I looked at him, and he looked at me, and I said, that was total shit.
Direct.
Really direct. Really direct. Really timely. And I said things.
Specific, perhaps.
Oh, it became very specific. But man, I had everybody's attention. And I was like, oh shit, what do I do? Anyway, and subsequent in his residency training, turns out he never did that thing again. And actually, when I had him as a senior, I overheard him talking to the students to say, now, when you're working with Dr. Dewar, blah, blah, blah. And as his exit interview with Andy Nowak,
he reflected back that probably the best piece of feedback that he had ever received was when I confronted him. So that is nothing about what I just told you, except it's time to
coming back to my tell.
Right. So, I mean, you know, it's a challenging thing to do. Apparently, it is a very well-received thing to do if we do it meaningfully and helpfully that people can improve. So I thank you for your attention. I know we're at the end of the hour. Oh, we're more than that. I'm so sorry.